And let's move on. And Dr. Cole, one, I guess, silver lining in the COVID situation that's happening in this world is that golf is really up. It's amazing. It's on the rise. More women and juniors are playing golf than ever before. The golf courses are packed. I'm quite familiar with the golf scene in Chicago, still doing a golf television show on NBC Sports Chicago, and got to know a lot of the major manufacturers, and they are selling out like they can't make golf balls and golf clubs quick enough for the stores and the pros and who are selling the clubs. So it is amazing, and that's why I thought we'd bring on Joe Estes. Joe is with Athletico Physical Therapy, and in Oak Brook they have an incredible golf center, simulators and golf-specific rehab, biomechanical evaluations, fitness programs. So it is great. And I want to bring on Joe Estes to tell us about that. But first, Dr. Cole, has there been any uptick in your practice with golf injuries?
Steve, there has. I think there's a couple of things that are sort of happening here. One is people just want to be outside. Two, if you look at sort of high school sports, even college, if they could do it, that's one sport that you can actually do safely. And so people are really doing everything possible to be active, and this is like one of the things that makes them feel good. So I'm seeing an uptick in patients who are coming in and saying, look, I just want to play golf. Can you help me fix my shoulder? I haven't seen a lot of injuries to date, but I've seen people who have had these long-standing issues that are using golf as a primary reason because they just want to get out there to just because I think it's a feel-good thing, and this is something that people can participate in. There's a little bit of camaraderie, and it feels particularly safe.
Well, Joe Estes from Athletico Physical Therapy, thanks for joining us here on Sports Medicine Weekly. Joe, tell us a little bit about the golf offerings at Athletico.
Yeah, great to join you guys. It's been an interesting year in the world of physical therapy and golf rehab. With what I do, I usually see a pretty high volume of golfers anyways. This has been an interesting year with COVID, but I'm still overseeing golf rehab through the Oak Brook facility where we have the Golf Performance Center. So people that are golfers that have current injuries, whether it be as a direct result of golf with overuse or whether it's another injury that is sustained elsewhere, but they're an adamant golfer, busy with that. We also have our performance packages where I do more golf-specific kind of personal training, strength and conditioning for people looking to do very golf-specific movements to improve their performance that way, as well as some biomechanical evaluations where I take them through an assessment through the Titleist Performance Institute, identifying physical limitations and restrictions that impact the golf swing and the performance in the golf swing and potentially causing injury. And we look at the golf swing from a biomechanical standpoint, not from necessarily instruction, but we educate them on how their body moves and how that interacts with it, how it kind of relates to the golf swing and their limitations with their movement and why it might be causing limitations in their performance or causing the pain they're having.
I'm curious if I want to get someone to see you for this purpose. Is this prescription-based or is this a programming? I know you guys have a number of different programmings available in this area, but is it a script covered by insurance, outside program? How does it happen, and how do I get a patient to you?
Yeah, so if it's a patient of yours, Dr. Cole, then the idea is you can just refer them straight for physical therapy for whatever their ailment is, because 95% of the time they're going to have pain that's impacting both their golf but also daily function as well. And so that's how we see them with a script, where we're still trying to do things to get them back to functional activities without pain, whether it's work-related or just daily activity-related, but then also incorporate some things that are golf-specific into their program as well. If we're looking at doing things that aren't injury-related and they're just talking about performance-based, then you would just refer them over to me, not through insurance, but you'd go through a cash-based system, whether that's the biomechanical analysis or whether they want to sign up and do more kind of training sessions with me.
Busy with Joe Estes, Athletico Physical Therapy and their Golf Performance Center in Oak Brook. I'm Steve Cashel with Dr. Brian Cole at Sports Medicine Weekly. Joe is a physical therapist, a TPI Level 1 certified golf fitness instructor. You also do some trigger point therapy and dry needling as well, Joe. Is that right?
Yeah. I've been doing dry needling now for probably about coming up on close to 2 years. Fully certified to do pretty much every muscle that we've learned how to do throughout dry needling course. So works really well for all patients. Golfers I've been doing it a ton on. you look at most golf injuries are mostly overuse as opposed to structural problems. And so with overuse comes a lot of muscular imbalance, a lot of compensations, and dry needling is an awesome technique that gets blood flowing into the muscles and reduces trigger points and referred pain, and just a really, really good intervention that physical therapists can do, to help their patients get out of pain and move better and perform better.
Dr. Cole, I want to tell you that after you did my surgery on my shoulder, my tenodesis, and we had bone spurs and arthritis in my right shoulder, I not only went through the physical therapy, but also I did the dry needling, and it was a little funky, if I can say that, but I tell you, it really helped, and I really enjoyed it, and I highly recommend it. Have you ever had it done, Dr. Cole?
I have not, but I've certainly seen a lot of it. We've had some athletical therapists in the training room at the Bulls facility, for example, and they use it there. I'd say it's becoming a standard as far as offering a new modality for people for muscle dysfunction. And I've been pretty impressed that it's made a difference in some of these really challenging conditions. So big fan of it, but I've never done it. Did it hurt?
No, not at all. Not at all. It feels a little different. There was no pain though, but I really, it just gets the muscles kind of triggery. Joe, maybe you can explain it better than I can describe it.
Yeah, I think part of it depends on the muscle that you're having needled. I'm assuming you probably had some muscles needled around the rotator cuff, which those are pretty good muscles to have needled if you're gonna have it done. Getting the upper trap, the upper trapezius up in the top of the shoulder, that can be a pretty tender muscle to have needled, just because so many people carry a lot of tension, a lot of restrictions, and they compensate a lot with that muscle. The calf can be a little achy, and it leaves you a little sore. I always describe it as, it's going to feel like you had a good workout the next day. But usually the pain is really what you're getting the dry needling done for. But it has some other perks, improving muscle function and the mobility of the tissue and things too.
Let me ask you a golf-related shoulder question. I've had a number of people who are right-hand golfers, and Steve, you'll probably understand this as well, that our right-hand golfers have a left shoulder injury, and they find that when they're favoring their left shoulder, they tend to be a little bit more accurate and their distance actually improves. I don't know if it's a power thing, so I guess that would be the forward arm. You know how good a golfer I am, Steve. So it'd be their left non-dominant arm, golfing righty, and they say that they actually can play better when they're recovering as long as we allow them to play golf. Is that an issue of just less, having less power, less, you get rid of some bad mistakes? Do you have any ideas?
Yeah, I mean, that's going to probably tend more towards the instructor side. Is biomechanically, if you're a puller, amateur golfers, a lot of them are pullers of the club and kind of not swingers of the club head. And so you can tend to get too upper body dominant. And when you tend to pull down through the ball, you can get a little bit steeper and make some, kind of come down with a little more force on the lead shoulder, so the left shoulder for a right-handed golfer. It may just be that if they're trying to favor the left shoulder a little more, they might be restricting the backswing a little bit more and maybe just kind of having a little bit of a more succinct swing. They just tend to stay on plane a little bit better and just deliver the club head to the ball a little more effectively. But, that's probably more of an instructor question, looking more at the, swing planes and things like that. But that's kind of what I would give you from the biomechanical side.
Again, we're visiting with Joe Estes, Athletico Physical Therapy. They have a great golf performance center in Oak Brook. I'm Steve Cashel with Dr. Brian Cole. You're listening to Sports Medicine Weekly on this Sunday morning. And Joe, as we leave you, tell us about your golf simulator. It's only a few years old. Is that correct?
Yeah, I think we've had it for 3 years now. We run a winter golf league. It's open to the public, so even though it's inside Athletico, the general public can come in and use it. You don't have to be a patient to come in. It's just a cash-based thing. We have a very competitive price that we do. It's not our moneymaker for our clinic. We're a physical therapy clinic. It's just something, being the golf performance center, that we kind of have that extra perk to give to the public, the golfers of Chicago that want to work on their swing in the winter. It's, real-life golf courses that you can play, some really, really good ones on there, and I get to use it for my patients. But we have a winter golf league every year. You can come in and use it, driving range, play 18 holes, play 9 holes on a lunch break. It's pretty quick. The graphics are really cool, and it's a lot of fun. If you haven't done it, it's a great time. If anyone's listening and wants to try ours, I'll let them come in and do 50% off their first round. Just mention that you heard me on the show, and I'll let you try it out and see what you think.
Fantastic. You guys are right across the street from Oak Brook Mall, correct?
Yeah, 83 and 16th Street across from the Oak Brick Mall. You got it.
Fantastic. Athletico.com is their website. Joe Estes, our guest from Athletico Physical Therapy and their Golf Performance Center out of Oak Brook. And this being a very, very big time for golf in the area, despite the coronavirus. But it's good to see that that golf is on the rise. Let's hope we get rid of this virus, but golf continues. So, Joe, thanks so much for joining us here on Sports Medicine Weekly. Wishing you the best. We'll see you soon.
Always a pleasure, Steve. Thank you, Dr. Cole. Thanks, guys.
All right, we're going to take a break here on Sports Medicine Weekly. When we come back, it's going to be our Ask the Doctor segment. Got a couple of great questions from Dr. Cole. We'll tell you how you can get involved. You're listening to Sports Medicine Weekly, only on
670 The Score.